We have much better technology. So, for example, we know that 89% of the uninsured in our state live in 7 towns. And we happen to know the zip codes of those people within the town because of the census data. It's not some, don't think your privacy is being interrupted, or don't send letters to the editor, which will probably come.
You're on Facebook, right?
Yeah, that's right. That's right. Exactly. But we've got data now that we can actually micro-target to people that we didn't have before. So back at the Connector, we used very broad-based advertising, particularly using things like Around the Red Sox and such, which is like a semi-religion in Massachusetts. We don't have to do that now. So we're using community organizers within each of those towns. They're identifying for us community representatives within certain ethnic groups. Because if you've got a community champion of one ethnicity, that doesn't necessarily mean that he or she is going to be effective with another ethnicity, even within the same town. So I'm oversimplifying, but we're using really community people to help identify. Then we're using houses of worship, community activists. That worked extremely well for us in Massachusetts. We used the Greater Boston Interfaith Organization that actually went on Sundays, and the congregations went door to door to help enroll people on Sundays. And so we're learning from a lot of things we did in Mass.
All right, one more question, and you can certainly stay, gentlemen. Tan, Jack.
Thank you. Mine is related to people who work for small businesses.
Yeah.
As I understand what you're setting up is you can either go as an individual if you decline what a small business may provide if they provide something. Is that an accurate statement?
It's not. It's not completely accurate. The employee has to have a situation where the contribution charged by his or her employer exceeds 9.5% of their income.
Okay, so if I'm a small business owner, which I am,
yeah.
I'm going to be notified of these various things so that I can put a plan together, for example, for my employees if I wish to do that. And then they have the ability to say, yes, I'm going to be involved with your plan, or no, I will not be involved in your plan.
Just like now.
If they're not involved in the plan, then they still have to do something on an individual basis or pay a fee.
Correct.
And then as a small business owner, I'm off the hook for whatever the...
Correct.
Okay. And what do you do about spouses in those cases? Because you did say that they're not being covered. Do they also have to do something about coverage for themselves?
Yes, so the law is a citizen law. Right. It's not an employee law, it's not an employer law, it's a citizen law. So what the law is saying is that all eligible citizens 18 and above, 18 to 65, have to have health insurance. And that there are certain vehicles that they can get it. Now one vehicle could be you as an employer. And you've just identified some ways that you may or may not be able to provide insurance for your employees. And if you do provide it, there are means, depending on the income level of the affordability of the coverage you provide, means for that employee either to pick that coverage through you or potentially to waive out and buy coverage through the exchange.
So if, for example, I decide to cover employees and I say, yes, you can also cover spouses,
yes, then
they could opt for that as opposed to going out on their own.
That is correct.
Right.
That's correct. Thank you. That's about it.
Thank you all very much. I think if there are some other questions, would you mind staying another couple of minutes? I know it's a school night, but